Hello, Dr. Rashi. Hello, Nitish. Thank you for joining today. We are very proud to have you today. Dr. Rashi is more than 15 years experience in dental and oral surgery. Uh, so we need to start talking about uh, traveling abroad for dental and oral surgery is something now that it is getting more and more common between patients around the world and especially here in GCC. So we need to explore more about this world to have more in-depth understanding about what the patient is expecting to have and why should he think about this. So, Dr. Rashi, we need to hear from you first of all. What is your main specification or main experience in the or primary area of experience in the dental medicine?
Okay, first of all, thank you, Dr. Adil, for
You are
having us
welcome. You are
here.
welcome, Dr. Rashi. Thank you so much.
And yes, we are into this industry from the past 15 years plus,
Yeah,
my experience. And though, in India, we do a couple of procedures here, but in case we talk about dental tourism, so there are relatively some procedures which patient prefers to get done in India.
yeah,
My main expertise is doing single visit root canals, full mouth
mm,
implants, full mouth rehabilitations, and smile
mm,
designing in the form of dental veneers.
yeah,
Besides that, also we do a couple of procedures like Invisalign and couple of restorations and painless teeth extractions, Zoom teeth whitening, lot many procedures.
yeah.
So yeah, this is my expertise.
Yeah, I think this is very important. Okay, so about the volume, patient volume, uh, how many cases per year for those 15 years of experience? How many cases do, yeah, and approximately do over the year?
So I don't know in 15 years how many I did, but I
No,
can give
for
you
per year. I mean per year,
per year.
volume
I
per year.
can
Yeah.
just a rough estimate like maybe 300 plus implants and approximately 30 or 40 plus FMR cases, and again 50 to 100 maybe smile designing cases, or maybe more.
Mm, yeah,
Now I think I'll
mashallah.
keep a check
Mhm.
after a year how many cases I've been doing. But
Yeah,
this is
this is very good. It
approximate.
need only mathematics, but you need, volume in cases of complex technical, any technical surgeries or this volume matters because it keeps improving the muscle memory, the hand skills, all of this. So when we are talking about 200, 300 cases per year, this high volume ensure that also the percentage to see different like approaches and the different kind of patients who may have some rare conditions, all the possibility that you can see of this gets much higher when they are talking. Okay, so now I will talk in Arabic to express all what we mentioned. النهاردة احنا بنتكلم مع دكتورة راشي. هي دكتورة أسنان من الهند، معروفة في مجال علاج الأسنان بخبرة أكتر من 15 سنة. احنا حابين نفهم أكتر عن علاج طب الأسنان في الخارج وإيه اللي ممكن يخلي مريض يسافر لعلاج طب الأسنان. دكتورة راشي متخصصة أكتر في زراعة الأسنان، في التأهيل الكامل للفم وزراعة كاملة للفم وتجميل الأسنان وتصميم الابتسامات. عندها آه، حجم حالات تقريبا سنويا في مجال زراعة الأسنان ما بين 200 ل 300 حالة في الريهابيليتيشن أو تأهيل الوجه. عندها من 50 ل 100 حالة، و التجميل من 50 ل 100 حالة. احنا هنا بنسأل عن الأمور دي عشان نقدر نتخيل الخبرة الخبرة بتاعت الدكتور، ونقدر نفهم ازاي بنقيم دكتور قبل ما نسافر. الهدف من الأسئلة انك تكون عارف انت هتسأل عن ايه، وايه اللي بتحتاج تعرفه قبل ما تقيم دكتور قبل ما تسافر. علشان كده احنا النهاردة عاملين ده عشان يكون مجال للتثقيف والفهم في كيف بتقيم الدكتور وكيف بتعرف تاخد قرارك للسفر. So this is great, Dr. Rashi. Thank you so much. Now, we have a talk here in surgery. Usually we say that good doctor knows how to do surgery, better doctor when to do surgery, but the best when not to do the surgery. We always say this, and this is the highest level to say, yes, this patient, we will not do surgery. So because of the commercialization of this medical tourism, we need to hear from you when you should say no to a patient want to come and pay for to do his teeth. When it is not good for the patient, that you say no, it's better to wait until this or until that. So, what is your inclusion and exclusion criteria?
So, Dr. Adil, it's like we, before starting any case, we need all the reports of the patients in the form of CT scans and all. Maybe
Yeah,
CBCT for specifically CBCT for dental implants, if you talk about dental implants.
yeah,
So, in case we find in the scan any red flags in terms of that there is no bone,
mm,
then we straight away inform the patient that you need to either wait a little, or either this procedure is not for you.
yeah,
So, in case we are asking the patient to wait, so what we are doing is we, as a clinician, we are preparing his bone for
yeah,
grafting or any kind of prior procedure to be done for the
mm,
implants. If
yeah,
after that procedure we get a good bone, then only we can proceed with the implants. So I think the all it is about the case evaluation and case planning. If
yeah,
the candidate is good for going for an implants, all the flags are green, we go ahead with the treatment, we take the consent of the patient and everything. And in case there are any red flags, this too I talked about in plants. Supposingly in FMR cases, FMR is all about giving crowns onto all your teeth. If your teeth are relatively very smaller in size and they cannot go for the crowns, so we have to do an additional step of making the height of the tooth a little longer by the help of laser surgery, and then
yeah,
we can proceed with the crowns. So we are not saying no to the procedure, but yes, the final concluding line for this is case evaluation and case planning is very important, and that will be done priorly before starting the case.
yeah. I think this totally makes sense.
Yeah.
So, if we are talking that it's all about the patient condition before
Yes.
starting treatment, once his condition is perfect, then there is no there is no red flags.
Yeah.
So, if we are talking about the challenging scenarios of patient with severe bone loss, failed implants before, or medically compromised, let's say if he has some immunodeficiency or some uncontrolled diabetes, all of these, how can you manage these highly complex cases? Because this is sometimes what is the patient is really searching for, some experienced doctor who will manage what others fail to manage.
So, if I talk about step by step, number one is if the normal implants are not possible in a patient's case because of the bone loss. So, there are different category of implants by the name of pterygoid implants. So, those implants are
Pterygoid?
pterygoid implants.
Yeah,
So, so these implants are specifically designed for the cases which have severe bone loss, and we cannot do normal implants in that
yeah,
patient, right?
yeah.
Number second is if we talk about any underlying condition like uncontrolled diabetes, that Dr. Adil patient has to consult his clinician and he
Mm,
has to maintain his sugar levels. Because ultimately, whatever the best quality implants we do, if the body is not accepting those implants, so
Yeah.
then there is no cure for that. And
Yeah.
in case, yes, I have seen lot many cases in my practice with uncontrolled diabetes, even for extractions also. So patient, they do work on themselves. They control their diabetes, control yeah, their diet and everything, and then they come
Yeah.
to us for their dental implants or beat any kind of surgery. So
Yeah.
treatments are available. I'm not denying. Only for the worst cases in where there is zero possibility of giving anything, then we
Mm.
cannot do it. But yes, for the complex cases, we have pterygoid implants. We have other implants by the name of basal implants. So definitely we have something. And again, planning, because we will get everything via CBCT. CBCT
Yeah.
is the picture that tells us everything, that which implant is possible, which not,
Mm.
what kind of implant patient can take, and everything. So we can
Yeah.
manage complex cases. Plus, we have a dedicated team of doctors who works on complex cases only.
Mm. I
So they're
think CBCT scan just for the patients and viewers to understand. It gives us like 3D image of
yes,
the bone,
yes,
all the depth where the nerve is, so you can
3D view.
have,
Yes, it's
yeah,
a
3D view. So no surprises. It's all well planned, and all the
yes.
implants are
Yes.
planned.
Yes.
In this.
Even
Uh,
if we tell what we tell our patients when they're going for CBCT, advise CBCT for the complete jaw for implant assessment. So we
mm,
write the terminology for. So what Dr. Adil they do is, so they place virtually all the implants in CBCT.
mm.
What size, diameter, depth, and everything.
It gives you all this information.
Yes.
Yeah, I
Yes.
think this is very valuable, very, very valuable.
Yes.
Uh, you know,
Yes, yes, please continue. I just wanted to
no
show
problem.
you in case I have that image.
Yeah, it will
So
be very good.
then that would be a little just 1 second.
Okay, so I will translate until you prepare the image,
Yes, yes.
or it's ready. If it's ready,
No,
we
no,
can
no, you
see
can
now.
translate. I'm just making it ready.
Okay, okay, take your time. So احنا سألنا الدكتورة راشي عن ايه هي ايه هي الكرايتيريا، او ايه هي المواصفات اللي بتقبل بيها عيان او بترفض عيان، لانه في مجال السياحة العلاجية رفض عيان جاي يسافر ويدفع فلوس ده مش حاجة يعني مشهورة او معروفة، لكن ده اللي بيفرق الشخص اللي هو بيتعامل معايير طبية واضحة وكدرجة أولى، وبعدين الأمور المادية. فهي اتكلمت عن إنه الموضوع كله يعتمد على تقييم الحالة. تقييم الحالة هو اللي على أساسه بعد كده أي قرارات بتتاخد. وفي تقييم الحالة هي بتستخدم علشان بالذات زراعة الأسنان ما يسمى CBCT. CBCT ده أشعة مقطعية على الأسنان معمولة بطريقة معينة، بتدي صورة ثلاثية الأبعاد عن العظم اللي هيتزرع فيه. لأن في كذا نقطة هنا. أولا، سمك العظم وعمق العظم ده بيفرق جدا في نجاح عملية الزراعة. كمان اللي بيفرق جدا وجود العصب ومكان وجود العصب، وده بيكون شيء مهم جدا. CBCT بيساعدهم برضو ان هم يحطوا خطة كاملة قبل ما يبدأوا الزراعة. You will show now, you will show us now, دكتورة راشي, CBCT.
Can you see this image, Doc?
Yeah, I can see this.
So the red part is the implant. So we are
Yeah,
planning the implant in, this is tooth number 16.
yeah.
So if you see the dimensions, it's very well mentioned, 5.0
Hmm.
and 8.5. So 5.0 is the diameter of the implant and 8.5 is the length of the implant.
Yeah.
So they have dedicatedly placed an implant virtually, that we have to maintain this much of depth and this size of the implant.
Mm. I think this is very detailed and very good.
Yeah.
Okay. وهي دي السي بي سي تي ازاي بتدينا دقة كاملة وحتى في المقاسات، وبتساعد الدكتورة انها تخطط للعملية بتاعتها. علشان كده دايما بيكون بعد تقييم الحالة والاطلاع على الأشعات وكل الأمور دي بتيجي الخطوة اللي بعدها. هل المريض جاهز، ولا ممكن نقول له انتظر شوية، ولا ممكن نقول له لا مش هينفعك موضوع الزراعة ده وفي بدايل تانية. فمثلا لو مريض عنده سكر مش متظبط، عنده مشاكل مناعية، فهنا بيحتاج المريض إن هو يعمل ينتظر لحد ما المشاكل المرضية دي تتحسن. أما لو المريض العظم بتاعه متآكل تماما، ما فيش عظم عشان يشيل زراعة الأسنان، هنا المريض ممكن يحتاج لدعم أو ترقيع للعظام بتاعة الفك. تمام. وفي حاجات تانية زي ما يسمى تريجويد امبلانت، ده خاص للمرضى اللي عندهم تآكل تام في العظام ومش هينفع لهم الزراعة العادية. Okay, Dr. Rashi, thank you so much. I think this is very helpful to see this, uh, and also to understand how this process is going.
Yes, it gives you a
In
clear
terms,
idea. Yes.
yeah, it's very good. Okay. So now we want to talk about something that is very important for any patient visiting a dentist, which is the about sterilization and infection control and all of this. So how do you make sure that everything have got its proper way of sterilization and everything was done perfectly?
So, Dr. Adil, in the world, the best way of sterilizing anything is using a B class autoclave. That is the
Mm.
core, that is the heart of sterilization at any clinic, right?
Yeah.
So we have that facility in house, and we make sure 99.999% of the infection control and the sterilization process is carried smoothly and is taken care by the B class autoclaves. It kills, as I said, 99.99% of the pathogens, including the spores as well. And after that, once the sterilization is done, we have a couple of UV chambers installed in our clinic so that they maintain the, supposedly, if we have sterilized the instrument today and they are not being used, certain instruments tomorrow or day after. So to keep their sterilization activity active, we have certain UV chambers at our clinic, and their sterilization is at par even the next day, or after 3 days, after 4 days, after 5 days.
Yeah, so it's not only about sterilization, it's also about storage after sterilization. This is
Yes,
important.
yes. We cannot store them openly anywhere, no? So if the
Yeah,
sterilization, there is no 100% surety that the more we have sterilized these couple of instruments today and they are being all utilized the very same day. So we have to make those conditions storage which are under this of the environment which we are giving to these instruments. They should be 99.99%
yeah,
storage according to the sterilization needs. So we have
yeah.
UV chambers and they.
It's called B class autoclaves. Yes, like
Yes,
this.
it's
B
called
class.
B class. It's so there is two types, N class and B class. So N class doesn't provide 100% of active sterilization. Only B class autoclaves, they take care of the sterilization process, and they
This is
guarantee
very,
full sterilization. And we have packed instrumentations. Just a second, Dr. Adam.
yeah. Take it. So أنا هنا كنت بسأل دكتورة رشا عن التعقيم، لأن نقطة التعقيم في عيادات الأسنان دي نقطة حساسة جدا. فهي قالت إنه أعلى معايير التعقيم بتتم أوتوكلاف، اللي هو بيكون زي الفرن التعقيم بيسموه أوتوكلاف. ففي ما يسمى بالبي كلاس أو كلاس بي من الأوتوكلاف، وده بيعقم ل 99 فاصلة 99.99% من البكتيريا بيقضي عليها، بما فيها البويضات أو الحويصلات بتاعة البكتيريا قبل ما تتولد. النقطة التانية اللي ذكرتها دكتورة رشا هي نقطة التخزين، وإن هم عندهم غرف مخصصة لتخزين الآلات دي عشان تفضل معقمة لمدة يوم أو يومين طالما إن هم ما استعملوهاش. Thank you, دكتورة رشا.
I
I
just wanted
think
to
this is
show this
really
is how the
important.
packaging looks like after sterilization.
Yeah,
The instruments are totally packed in
yeah.
this kind of sheet. It's so
This is
it's,
how the patient is expected to
yes,
see his
yes.
instruments before using.
All the instruments, all the instruments. This will open only in front of the instruments.
Yeah,
Because
yeah.
these whole packets, these are not packed after the instruments get sterilized. This complete packet, after cleaning it with the alcohol and everything, swab, they are put into the sterilization chamber. And they come sterilized as it is. Now we are not touching.
Yeah, yeah. So the packaging before sterilization.
Yes.
Yeah. سألنا تورينا ازاي التعبئة او التغليف بيتم قبل التعقيم، وبالتالي بيدخل الآلات وبتطلع مقفولة خلاص ما فيش حد هيلمسها لحد ما الدكتور انت بعينك تشوف الدكتور بيفتح او الممرضة بتفتح للدكتور الآلات علشان يستعملها وتكون متأكد من التعقيم. Okay, this is, I think, very informative and very relieving to see the nurse opening for you this instrument. For me, no one touched it after sterilization. This feel like the relief. So, what about the success rate and how do you follow your patients for 5 years, for example? Because it's usually very high at the beginning, but I think many factors affect the long-term success of an implant. So, what do you think about this? How can we follow up this outcome, long-term outcome? Or in your facility, how do you follow up this long-term outcome?
So, we usually initially, when the patient has got the treatment done, then for the initial 2 to 3 months, we do follow-up calls to the patient to see that everything is fine and all. And in case some kind of assistance is needed wherever the patient is, we ask the patient that whosoever they are visiting as for the follow-up appointments after say 6 months or 1 year or once in a year, so they can have a call with us, with that dentist whom they are visiting, and we can have one-on-one conversation also to see that everything is fine. And we can also tell them to get the scan done, and they can share they can email the reports and everything to see everything is in place. So once, otherwise, there is no much complication which arises if we have done procedure very accurately and planned everything nicely. But only follow-ups is like once a year, follow-up is required, doctor. And if patient is happy to visit India back, they can visit us anytime. And if not, they can visit their nearby dentist. And I am happy to take the call of the dentist, whomsoever they are taking a consult.
I think this is very valuable if the patient will have the opportunity for his local dentist to talk to you more in depth about the details. I think this is very valuable. Okay. And then for the patient to understand as an informative way or to have this in-depth understand, what are the most common complications that the patient should take care from, or should what are the most common complications even in the consent when the patient is signing? What are the most common complications for this procedure?
Or before starting the treatment, Dr. Adil?
No, complication after treatment. What are the most common?
Expect after the treatment.
Look, like any procedure, there are some documented complications which vary in the probability.
Hmm.
Okay, some are more common than others. So what
Yes.
what are the most common complications
So if
in
I
this dental?
yeah, if I talk about dental implants, the failure
Mm,
of the implant, it
yeah.
can happen. Number second, if in FMR, there can be dislodgement of the crown. And
Mm,
veneers also, it is like dislodgement of the veneer.
mm,
But as I said, they will not come out instantly.
mhm,
If I talk about number one, dental implants, failures of an dental implant can happen. And usually, Dr. Adil, what protocol we follow here is we always, first of all, the planning is if planning is good, then everything goes well. Supposingly, if failure occurs, one of the implants gets failed. So, we always, when we are doing the full mouth cases for dental implants, we always put some extra implant during the
mhm,
procedure only, so that in case one of the implants gets failed, then there
mm,
is no damage to our existing prosthesis,
mm,
right? So that it should not be like the one implant is failed, now the patient is without teeth. This will
mm.
never happen. This will never happen. What
Yeah.
worst can we expect is in case it fails, he has to go to a nearby dentist to get that implant only pulled out, because
Mhm,
fail means loosening only. So the implant
yeah.
is not got submerged with the bone, it has failed
Mm,
due to natural healing factors.
yeah.
So the patient can go to the nearby dentist and get it removed, but this will not hamper the complete treatment. Never.
Mm,
The same
yeah.
prosthesis, the crowns which we have given on top of the implants, that same
Yeah.
prosthesis will be there on tourist teeth.
Mhm.
And simple for
Uh,
an FMR, if the crown is getting dislodged, I mean dislodged in the sense, if it is getting removed, he can simply go to a dentist and get the crown lubed just with an adhesive. And
yeah.
simple for the veneer, in case that gets dislodged or removed, he can go to a
Mm.
dentist and get the veneer luted with some kind of a cement which we are using.
Yeah. And this takes us also to one important issue about the brands used and all of this that is globally recognized so the
Yes,
patient can have.
yes,
Ah, so this is very important for the patient to know that these implants used are recognized back in his country, globally around the world. So the
yes.
hardware for removal, all of this is available.
We'll take
Okay,
care.
thank you.
We'll take care of it before
Yeah,
proceed. Yeah.
yeah. طيب أنا اتكلمت مع الدكتورة راشيا على نقطة المتابعة، إنه المريض أنت طبعا زي ما قلنا الهدف من دي إنك أنت تعرف إيه هي النقاط المهمة اللي أنت محتاج تعرفها قبل ما تسافر عشان تاخد قرار. فقالت إن المتابعة في أول من شهرين ل3 شهور بيكون في بروتوكول معين في المتابعة في بلدك بتتابعه عادي، وبعدين 6 شهور وبعدين سنة. وإنه لا قدر الله في حالة وجود أي مشاكل بتكون متاح إن الدكتور المحلي اللي في بلدك يتواصل مع الدكتورة عشان يتكلموا أكتر عن التفاصيل والأمور دي كلها. ولما سألنا عن طبيعة المضاعفات اللي ممكن تحصل، فهي في الغالب هتكون لها علاقة بإنه فشل الجسم أو فشل الزراعة دي أو بدأ يحصل زي تخلخل فيها أو كده. وبالتالي بيكونوا واخدين احتياطاتهم إن ده ما يؤديش لفشل للسنة، وإنه يقدر يتعالج بصورة موضوعية للزرعة الوحيدة اللي حصل فيها المشكلة. ونقطة إنه هنا دي نقطة مهمة جدًا، إنه الماركات أو الشركات اللي بيستعملوها شركات معروفة دوليًا، وبالتالي مش معنى إن أنت عملتها في الهند يبقى أي تضبيط أو أي تعديل أو أي علاج محتاج ترجع تاني، لأ، هي معروفة في دولتك ويقدر الدكتور إن هو يصلحها في دولته. I think this is very important. All what we mentioned is a very valuable data that the patient who is thinking about traveling abroad should think about and should be aware about to take his decision.
Yes.
Uh, yeah. And then when it comes also to traveling abroad now, this the concept of package, okay, in terms of cost and all of this. How can the patient understand these packages, and what does it offer to the patient, and if he may have any surprises after traveling, or this is exactly what he will pay. And also, sometimes it's not just uh, our bodies doesn't work like this, so surprises may happen even after very good planning. Before doing, sometimes we find things that we were not expected. So if the patient is traveling with packages, how can we manage this uh, scenario?
So the costs are very transparent, Dr. Adam.
Yeah.
And once we have all the reports, we will plan the treatment and we will share a very transparent cost with the patient. In rest,
Mm,
with Nitesh with us, he will look after the travel, visa, and everything. We both
mm,
will club the cost together and we will put it in front of the patient.
yeah.
Yeah.
So this cost will be itemized for like this is the cost of this step and this step. If you
Yes.
need further
Okay,
diagnostic, all of this
maybe
will be mentioned. Yes,
yeah,
Mr.
Dr.
Nitish,
I
hello.
wanted to add here. So whenever we share the cost and treatment plan, we can give the breakup of how this cost has arrived, what is included, what is excluded, and what
Yeah,
all other factors are involved into it. For example, the
yeah,
visa process, the flight, and a hotel, whatever the breakup we will provide. And on top of that, whenever we have a chance to talk to our the patient, we will explain them also how these numbers are coming up and down, all those things. So this is
yeah,
very much doable, and it will be like on paper as well as face, like in the meeting as well, we will explain.
yeah. I think this makes a big difference for the patient, especially what is included and what is excluded,
Yes.
because he will not be surprised when he says some extra expenses because this was not from the
Yes.
beginning included in the quotation that he received.
And that gives a
Okay.
negative feedback also. I mean, that's not good also. Now, if we take it on to us
Y-
also, or every
Yeah,
or anything. So we will also not like to have any surprises once
So
we
even though in
yeah.
Divine Heal we have no surprise policy, so we explain everything to patient, including his travel, logistic, stay, and if he
Mm.
required any local support, the local SIM card, forex, anything he need, we will provide him, and we give him a detailed plan beforehand. So there'll be no surprise.
I like this no surprise policy, Mr.
yes,
Nitish.
Yeah, yeah.
interesting.
Yeah, it's well said. So because when the comfort of the trip and the patient find everything, as Mr. Antish mentioned, no surprise. When the patient feel that everything is taken care of, he just would need to focus on his treatment and to be relieved. Uh, Even this has an impact on his immunity. It's scientific talking. It's not just what we imagine, because the stress significantly reduce the immunity, they reduce the healing power of the patient.
So,
So having someone
Dr.
like
Riley,
Mr.
why we come up with this policy also? Because see, in the end, patient already suffering with some issues, right? He
Yeah,
having that
yeah,
issue, and on top of that, he need to travel some another place. So there are like
mm,
people who traveling just first time across the country or across the border for the
hmm,
treatment purpose. They already have a lot of anxiety, and this is
yeah,
one of the things we wanted to reduce their anxiety. And you mentioned correctly, like it will help them to have better immune and better, a process altogether. So that is the reason we also come up with a whole this policy.
I liked it. Okay, let me translate. اتكلمنا هنا في القسم ده عن التسعير. وفكرة الباكج أو الباقة في التسعير والأمور دي. لكن هنا بيدخل مستر نتيش مع دكتورة راشي ومستر نتيش من ديفاين هيل شركائنا في الهند، علشان يتعمل لستة كاملة بالتسعير بالتفصيل لكل نقطة موجودة، وإيه هي النقاط المشمولة في التسعير وإيه النقاط الغير مشمولة، علشان عندهم ما يسمى بالنو سيربرايز بوليسي، يعني ما فيش مفاجآت بعد السفر. وده برضو ليه تأثير على مدى الارتياح بتاع المريض. ده هنا بياخدنا على التخطيط لما قبل السفر. انت محتاج تخطيط في الجزء الطبي ومحتاج تخطيط في الجزء اللوجستي، والجزء اللوجستي غاية في الأهمية عشان الراحة الذهنية والنفسية أثناء السفر. فوجود شريك موجود في البلد اللي انت بتسافر لها واخد باله من كل الأمور اللوجستية وكل الأمور اللي لها علاقة بالتخطيط للتنقلات، لتطلع السيم كارد، شريحة الجوال، للترجمة، للأمور دي كلها، للعملة وتغيير العملة. كل الأمور دي بتفرق مع المريض، بالإضافة لأن معاك فريق طبي بينسق لك الرحلة الطبية قبل السفر وبيتواصل مع الطبيب ويفهم منه ويتأكد إنك أنت فاهم، مش بس ترجمة لغوية عادية ولكن ترجمة طبية احترافية. كل ده بيكون له تأثير عميق جدا على النتيجة. طيب، فهنا بنوصل لآخر نقطة معانا، وهي استمرارية العلاج. So, Dr. Rashi, for the continuity of care, you just mentioned you are ready for giving the patient the help he need, even talking to his local dentist. If we asked about when the patient is discharged and he has his discharge report, what type for the extent of details that is mentioned, like the brand used in his implants, the details of the surgery, any findings that you found in the surgery,
Yes.
imaging modalities he had. I think this is very important, not for the patient not to find himself like after going back to his country that he don't know where to go. Uh, so, what do you think about this?
No, we will definitely be giving all the reports, whatever we have
Mm,
done, along with the digital x-rays we have taken,
mhm.
and
Yeah.
plus the end result of the treatment, the final result with the final
Mm,
x-rays. During the
mhm,
treatment, we take a lot of x-rays, but once the patient is finally discharged, then we
mm,
take final x-ray indicating that these all are the implants or these all are the crowns which we have given to the patient. So
mhm,
we will hand over all the reports and with the specific brand which we have put,
mm,
size of the,
mm.
because we have implants with different sizes depending
Yeah.
upon the quality of the bone and the size of the bone, which size of implant will suit best to the patient. That is all with the CBCT. So whatever implant we are putting onto the patient, that one
Mm,
sticker, it has 2 to 3 stickers onto them. So one sticker
mm.
we keep it with us, and one of the stickers we put it in the patient's record. So that record
Ah,
we hand over the patient. It's not a written is just what procedure we have done, but the implant sizes and everything that is particularly already in the sticker form which we have delivered to the patient.
mm. Yeah. Sticker. So something
So
like
at the implant ka, there is one bottle. So implant
uh,
is encased in that bottle, and on top
yeah.
of the bottle they have not on the top of the bottle. The bottle is again in one kind of a box. That box of the single implant has certain stickers mentioning the width of the implant and the size of the implant. So that
Mm,
with the brand name. So that one
yeah.
sticker is with us, and the another sticker is with the patient's history. See,
This
it's
is
not
great.
with these patients who are traveling from abroad. Otherwise, also, if the patient is in India and the patient is not, the patient has got the treatment from me and patient has traveled to, say, Mumbai, and then he wants
Yeah.
to show that this implant has been done from here. Even many of the patients come to me with some kind of a changes after maybe 10
Mm,
years. They need some kind of an assistance. So I
yeah.
need to know which brand of the implant it is. With the X-ray,
Mm,
I can't make it out. Okay, which quality of implant.
mm,
So they
mm,
show me that this was the size and this is the name. So then I need to assess my instrumentation and everything, whether I have these components that I'll be able to fix this. So that is all how it works. So that will be
Yeah.
typically the patient. It will be.
Yeah. اوكي سو هنا دكتورة رشي شرحت لنا ازاي بيتم نقل المعلومات الطبية والملف الطبي معاك وانت راجع علشان يفرق عشان الدكاترة المحليين يقدروا يتابعوا معاك. وفي نقطة عبارة عن ستيكر بيكون موجود على العبوة الكبيرة اللي فيها الامبلانت ده، بيتاخد منه نسخة عند الدكتورة ونسخة في تقريرك الطبي علشان تكون معاك تفصيل كامل للبراند أو العلامة التجارية بتاعة الإمبلانت ومقاسات بالظبط في حالة لا قدر الله احتجت أي تعديل على الإمبلانت ده، وده مع التفاصيل الدقيقة للعملية واللي حصل والعلاجات اللي أخدتها والأمور دي كلها ومع استعداد الدكتور رشيد الكلام مع الطبيب بتاعك. هي دي المعايير اللي احنا المفروض نكون بندور عليها في حالة الرغبة للسفر للعلاج بالخارج. الهدف هنا مش إعلان لأحد ولا إن احنا نقول إن ده كويس أو وحش، ولكن الهدف هو تنشيط طريقة التفكير، إزاي أحكم، إيه الحاجات اللي أنا محتاج أكون عارفها علشان أخد قرار أيا يكن المكان أنت هتعملها، حتى لو هتعمل محليا في بلدك. دي الأمور مشتركة ما بين الدكتور المحلي والدكتور الدولي. هتعمل عملية، تعمل أي شيء له علاقة بالأسنان، الأمور دي كلها محتاج تكون في دماغك وأنت بتاخد القرار. وفي النهاية ده كلها أخذ بالأسباب والشافي هو ربنا سبحانه وتعالى. Dr. Rashi, thank you so much for your time. It was been such a valuable and informative interview. I think you give us a lot of in-depth understanding, and I think that everyone who's thinking about visiting a dentist, he will find this very valuable. So again, thank you so much, and maybe we shall meet inshallah on our next visit to India to fix all this.
Yes. I think first we should do on you.
I will, yeah. Maybe we'll do our podcast, then live fixation of my teeth.
Yes. That's a good idea. But it was
Thank you
really
so
nice
much.
talking to you, Dr.
Yeah, thank you so much. Thank you, Mr. Nitish, for bringing us together. You have been such a great partner, and I really liked the no surprise policy. It's fantastic. So thank you, both of you, and inshallah we shall have next meetings more in details to talk, and maybe we can have like cases to discuss. So thank you so much, everybody, and until next time.
Thank you. Thank you.
Thank you, Dr. Reddy.
Thank you.
Thank you. Thank you. إن شاء الله لقاء آخر مع أطباء آخرين في تخصصات أخرى، نفهم أكثر التخصص ونفهم أكثر إزاي نفكر في السفر للعلاج بالخارج وإزاي نفكر في العلاج. Okay, goodbye, doctors. Goodbye. Thank you so much. Thank you.
Thank you, Dr. Raji. I'll keep you posted.
Yeah.
Once I get the videos, I'll share it with you. You can put it on your social media handle.
Okay.
as well.
Thank you. Thank you. Thank you.
Thank you.